I'm going to start by saying I had flu last week, so forgive me if I'm a little bit croaky and crackly. I'll do my best to get through this without stopping completely. Thank you, Sonia, for inviting us to share today. It's a really great opportunity to put into practice what Sonia's been talking about, which is collaboration, because none of us can get through this without working really closely together. And much of what Sonia's already talked about is reflected within the world of paediatrics. So I'm sure there's not going to be anything that I'm going to say today that isn't something you're already aware of. As Sonia said, we have some amazing GPs working with our children and young people, but nationally the picture is very poor. Every day on the helpline, we get calls to say, my GP will not diagnose, my GP will not refer me. And it's a big battle because that's your doorway to things changing. And so until we can change that picture of how GPs are addressing this condition, things are going to remain very challenging for our parents and children and young people. And that makes access to any kind of specialist medical care very much a postcode lottery. And when I say postcode lottery, it can actually be between practices in the same street. I'm not talking between towns and cities here, I'm talking between the luck of the draw between practices. And we need to change that, and we need to address it. Education is the biggest issue for our children and young people. Because of the lack of GP support, that then has a role and effect with education, because if your GP isn't going to support your absences from school, because of the current stress and pressures that education are under from Ofsted and the government, then they're going to be on parents' backs immediately as soon as their school absences start. And without those letters of support from medical practitioners, parents' lives become impossibly difficult. You're already really worried and anxious about the welfare and the well-being of your child, and then on top of that, you've got education all over you, demanding attendance at school. We even have one poor parent who drives her child to school every morning, virtually carries him in for registration, and then waits outside because she knows she'll get a phone call within 10 minutes to say you need to fetch him home, he's too ill. But he's been to registration, so it's keeping them at bay. And that's appalling, that's criminal, because then of course his energy for the whole day is being wasted, instead of using it wisely to perhaps access some education at home. What does this lead to? Well, the worst crime of all is threats of safeguarding. It's something that I work with 36 other national children's charities who work with children with long-term conditions. Not one other of those charities have members who face threats of safeguarding, child protection as it used to be known. There is something very wrong, isn't there, where your child is ill, you're trying to do your best to cope, and then you're the one that becomes accused of causing the problem. Of course, we always have to remain open-minded because children need our protection, but it's not good enough. For me, that was a real wake-up call that not one other of those charities had ever experienced a single case of threat of safeguarding, whereas in the last 3 years, we've supported 90 families in crisis, and many of those, it was because they were being threatened, some of the threats very veiled, with safeguarding proceedings, and some of them actually going forward to panel and to court. It has to stop, and it has to change. And the only people that can make that difference are people like you, sitting here in this room, helping Sonia and I to make a difference in the level of awareness. Every single one of us has a voice, and every single one of us has the power to make a difference. And on top of that, as many of you already know, people are now facing their benefits being taken away. So at a time when financial hardship has already hit, because one parent has had to give up work to provide care, now their benefits are being drastically cut or in some cases removed. We're very lucky at AYME in as much as we do rely heavily on the AFNI benefit helpline, because we can't afford to employ somebody to keep up to date with the changes in benefits that happen, it feels like weekly at the moment. But it's something that's essential because other national benefits lines don't understand the complexity of applying for benefits when you have ME or a child with ME. So what are we doing? Well, we're trying to address all of those things as best we can. But we're a tiny charity. there's only myself full-time with 4 part-time members of staff. But our voices are our members' voices, and by empowering them and informing them and their parents, it can and does make a dramatic difference. In the office, we work as closely as we can with the NHS specialist services. Now, we do come under some heavy criticism for this sometimes. No, they're not all perfect. But we believe it's only by talking to people and working with them that you can influence them. If we stand outside the door and shout and kick and scream, they're not going to let us in. But we've been working very closely with some of these specialist services now for 10 years. In fact, one of your local support workers was one of the first patient group representatives I met in this area, and she had a magnificent voice for people in the Sheffield area and did influence the delivery of services here in Sheffield. And it's really important that those patient voices continue to be heard. So we try and make sure that our children and young people's voices and our parents' voices are heard. And if there's a concern, if there is a complaint, we take it straight to those people that need to know about it, because it isn't always easy for a child, young person or parent to complain. We know that. People are worried about what the rebound, the repercussions of that could be. But we do take those complaints very seriously. We do hear them and we do act upon them. Really, education is the biggest challenge. A bit like GPs. 2 schools in the same road can have a completely different attitude and a different approach. But through the helpline, through the information that we've gained in all of these years working with our families, then we can make a difference. And just a phone call to a school, or where really necessary, a visit to a school from myself or one of our volunteers, can change the way that child is treated in school or taught at home. But it's promoting this recognition and understanding nationally that we, in collaboration with AFME and the other people that we work very closely with, has to change. That attitude on the street, that attitude of people you meet every day, that needs to change. And we just have to keep strong, and we just have to keep speaking. And Becca 16, I felt, put it really well. I just felt that school didn't understand until someone from AYME came in to talk to them. And it changed how they viewed me and my illness. And I can't thank AYME enough for that. So it was a conversation, and that's all it took. And your voices can actually deliver those conversations. Our helpline is still open every day from 10 till 2, and it's busy. It rings off its hook some days, and other days it's a little quieter. We don't get those little quick calls anymore. They're all dealt with through the wonders of modern media, but what we do get is some quite long, complex calls. So these aren't calls where we're calling people back and following up. Calls average between about 15 minutes now. And when you're only open for 4 hours a day, that's quite some demand. And these come from parents who are desperate. And they've usually waited too long, I have to say. So please spread the word that we'd rather people contact us sooner than later, because by the time we're desperate, the problem takes a lot more putting right. But we've got trained staff who have been doing this job for a long, long time and can provide people with the information they need to make a difference. We're really lucky that we've received funding for the next 3 years for a national support worker to help and support those 90 families I mentioned to you that are in crisis. One of them is located in Durham to cover the north of the country, and the other one in Milton Keynes covering the south, and there will be some overlap. But that's going to really take the pressure off. I mean, we can work with these families at a lot quicker, we can respond quickly and deliver the services they need. The other thing that is little known is that we offer a 24-hour alert service. Through our members' message board, young people can contact me 24 hours a day, 7 days a week, if they think they or their friends are at risk of suicide. We have lost 2 young people in the last 4 years to suicide, but we've actually prevented 5 cases. It's absolutely crucial that these young people can continue to contact us in the middle of the night when everything is dreadful. And that's one of the services that we're very proud to operate and will continue to operate. I'm really pleased to say that it's being less used at the moment, but it will continue to be there because we need to keep continuing to save those lives. As Sonia's mentioned, We work collaboratively with the same people that Action for AIME do. And I'm really proud to be able to say that our collaboration with Action for AIME is going from strength to strength at the moment. And it's a collaboration I'm very proud to be involved in. The voice of children and young people have to be heard. And it's only by us all working together at local level and at national level we can make sure that those voices are heard. So our priority tasks are here. We've got to increase the knowledge and understanding and secure that prompt diagnosis, because we know for children and young people it makes a difference. Children and young people do stand a better chance of recovery, but only if they're seen quickly and they get the right guidance and support, and all too often that's not happening. So we've got to have more access to paediatric services, and we've got to raise that awareness. We know that 1 in 100 school children are now affected by this condition. That's in the senior school age range, the 11 to 16s. If we don't do something about it, they will move into adult life with this condition, and none of us wants to see that happen. So it's absolutely crucial that every one of those children is seen and gets the diagnosis that they are entitled to and deserve. It's like everything and everyone else is on fast forward, and you're just constantly stuck on pause, is how Susie describes her Ellie. And it's like watching the world fulfil their dreams whilst you can't even dream. These are the things that we need to change for these children and young people. And they do. Our young people are out there. They're not sitting at home feeling sorry for themselves. They are inspirational. They are amazing. And Daniel and his family, only in November, came to the Department for Education with me. And Daniel spoke so passionately and clearly about what he felt the guidance on education should say. So their voices are being heard at that level. And I was so proud of him, because he was really treated with the utmost respect in that meeting. And I know that everything he said was taken on board and has influenced future guidance. In the same way as Tristan and his family joined me at the House of Lords to talk about the Draft Children and Families Bill. And again, so much of what was said that day was taken on board by the Lords and has been carried forward into the putting together of the Children and Families Bill. When people hear children and young people speak, they listen. Their voices are powerful. How do you do that with just 4 members of staff? Well, it's these amazing children and young people. We have hundreds of them that provide volunteer services for AIME, and they deliver all of these amazing direct services, which I'm sure some of you will have heard about. We couldn't do it without them. They are, again, incredible. They run the website, they make sure every child has a handwritten birthday card, because for some of them that's the only birthday card because they've lost touch with their friends. All of these things are what make a practical difference on a day-to-day basis to break that isolation. And working for AIME does give these children and young people a sense of purpose, whilst perhaps everything else is taken away from them. And we've got young people that have now gone on to be absolutely amazing in the fields, their chosen fields. One of them a manager at Tesco's, one of them a consultant working in a busy London hospital, all based on the volunteering they did for AIME, maybe for years without any mainstream education at all. In fact, the consultant didn't have any mainstream education from 11 to 16 years, and she qualified last year. It is possible. And we're trying to do more to get that volunteering actually acknowledged. So I'm going to close with James. I try and use our young people's words wherever I can. And James said, really, it's very simple. I think adults make it too complicated. What we want is just, we thought we got this right, but I'm going to put them all up because I've got a feeling it might pop up at the end. What we really want is consideration of patients' feelings and wishes. Obvious. Acknowledgement of the symptoms and restrictions that our MECFS causes. Respect of the patients' and parents' knowledge of their MECFS. And that came from him witnessing his mother being treated appallingly by healthcare professionals. Absolutely appallingly. And he said, how can they do that? How can they treat my mother with so little respect when she knows more about my ME than they ever will? And please just encourage me. No matter how small my achievements are, they are achievements. So out of the mouths of these children come very wise words. So thank you. Chloe said, Mummy said my bounce is finally coming back. And Chloe wrote a book which she delivered to her classmates to help them understand their need, which we've now published as a series of 3 booklets, because again, they describe it far better than we can. So thank you very much indeed.